And Dr. Fauci's words underscores what America was dealing with. It was that we couldn't change our society. We couldn't go back and give Black people better access to healthcare retroactively. And even though some people thought it was callous for Dr. Fauci to say there's literally nothing we can do, we've known about this forever, he was right. We know that a lot of Americans are gonna die. And we know that a lot of those Americans are gonna disproportionately be Black people. This is not a coincidence.
So at every single step, long-standing systemic racism of where people live, what kind of jobs they have, what kind of doctors they have access to, what kind of hospitals they have access to, just chipped away at what we first thought was going to be equal effects on white and Black communities. And what we saw at the end was not a small difference, but a huge one. These large gaps, much, much higher likelihood of getting infected, getting sick, and dying. Still too true today. I think the frontline doctors and nurses have done a heroic job. I don't think the blame is there. But the healthcare system should have been much, much more prepared for this and should have seen this coming. And that didn't happen. We often say, oh, that's just biology. So much easier to just explain it as biology. We've taken these effects of longstanding racism and we've almost created a biology around it, around lung function. We somehow think that there are differences in lung function between white and Black people, and the most classic of which is around pain thresholds and this idea that Black patients have higher pain thresholds, which is really an idea straight out of slavery and still continues to affect the way doctors think today. And so if you take something like hypertension, which again, we just sort of, in passing make the remark, oh yeah, Black patients are more likely to have hypertension than white patients. Well, what's that about?
I have a great relationship with my healthcare provider. You may have a great relationship with your healthcare provider. But what about the millions of Americans whose experience is different from mine and from yours? Yes, all of us make mistakes, but when mistakes become a pattern, we all need to pay attention, especially when lives are at stake. Health disparities were identified as a crisis in healthcare way back in 2003. That's 19 years ago. So little has changed since then. Our healthcare system is made up of so many caring individuals. We all know this, but the history of unequal treatment based on a patient's race cannot be denied. We have so much in common, and yet people of color are treated differently by a healthcare system that promises to do no harm. Sadly, it happens every day.